Glad everybody was there to help out. A healthcare facility in Muskegon County that we've been telling you about had plans to close its doors at the end of this month, but in the past few days, they've hired a new leader who is much more optimistic.
Aaron Parseeable joining us now after sitting down with that new CEO. Aaron?
Derek, Janice, Muskegon Family Care's new CEO, Daniel Oglesby, says they are staying open for the foreseeable future. The healthcare facility has struggled financially, and former staff members are now being investigated for embezzlement. But Oglesby says he's confident they can restore their reputation and finances and continue to serve the nearly 20,000 low-income patients who rely on the facility.
So I want to tell all the patients out there who are eagerly waiting as to our future and whether or not we'll be here. We're going to be here. We're here to stay, and you're going to have the same level of quality of service, if not better, by staying with us.
On his second official day on the job, new CEO of Muskegon Family Care, Daniel Oglesby, is humming a different tune about the future of the facility.
It is open. It is vibrant. I have an open sign which basically said we're accepting patients. That's our open sign on the marquee outside.
Over the past month, the facility has been a bastion of confusion for patients who were told the facility would be shutting its doors indefinitely and later at the end of March. And during all this, dozens of employees were terminated or they left on their own.
I believe that the leadership at the time and the management at the time decided that it was in the best interest of this organization to transition by closing its doors. When I arrived, I was able to see that, first of all, there were a lot of activities, and there was patient activity, and the providers were here, and it was vibrant. People seemed to appreciate the quality.
Oglesby was hired by the board on Thursday. He was part of a team that helped form the Spectrum Health system.
And so my job is to come in, stabilize the ship, move it into calm waters, and then let's begin to rebuild.
At the center of his plan is to create local partnerships, which he says is critical to build the facility back up.
The debt is not as large as I thought it would be, and the opportunity to build revenue over expenses is going to get greater as we move back into the full complement of services that we had less than 2 months ago.
In the meantime, their facilities will remain open, and Oglesby is encouraging patients to continue receiving care through them.
Not only are we back, we're going to be better, and faster and more credible in the future as we put in additional resources and systems to make this operation one that the community can be extremely proud of.